we're talking about a very important topic, diabetes. Right now, about 29 million Americans are suffering from diabetes, but now Ochsner Health System is working to help those in our area manage this condition. Joining us now is endocrinologist Susan Karam from Ochsner. Thanks for joining us this morning.
Thanks so much for having me.
Of course. So starting out, just tell us, what is diabetes?
Yeah, so diabetes is a chronic medical condition. It's characterized by high blood sugar levels. And we can't talk about diabetes without talking about insulin. Insulin is the hormone that we all make that helps control blood sugar in our body, keeps it from getting too high, prevents it from getting too low. And whenever our bodies don't produce or use insulin appropriately, that leads to high blood sugar levels, causing diabetes.
I see. And how common is diabetes?
Diabetes is relatively common. We estimate that about 8% of the American population, which is about 29 million people, have diabetes.
Wow, okay. And does this come with age, or is this something that's genetic, or?
It's a great question. So there are a couple of different causes of diabetes. One is type 1 diabetes, which traditionally was thought to happen in childhood, but we now know that can develop in adults as well. Type 2 diabetes is by far more common and does become more common with age, although unfortunately we are seeing more and more children and young adults developing type 2 diabetes as well. So age is a risk factor, but there are other risk factors like genetics, being overweight or obese, sedentary lifestyle, lack of healthy eating. All of those things can contribute to someone's risk of diabetes.
I see. Okay, so it sounds like, I mean, you can do your part early, right, to hopefully prevent maybe type 1 and or type 2?
Type 1 is more difficult to predict.
I see.
There are often genetic factors as well as environmental factors that we don't really have control over in terms of type 1 diabetes. But type 2 diabetes can be prevented. The most important things are helping to maintain a healthy weight, and we do that with regular exercise and activity as well as healthy eating.
Yeah, okay. Obviously we always hear that, and sometimes it's hard to just like get up and go work out, right?
It's true, it's true.
But you're doing yourself a service.
Exactly, and I recommend to people who don't exercise regularly to start slowly. The recommendation is 150 minutes, which we typically advise splitting into 30-minute blocks 5 times a week. But if you're someone who doesn't exercise regularly, you don't have to start with 150 minutes. Start with 2 days a week, taking a 20-minute walk, and slowly build up from there.
Sure. And I was going to say, what normally helps me is, you know, having a friend with you or a buddy, right? Because you kind of hold each other accountable.
Exactly. I think having somebody who helps motivate you and gets you out of bed in the morning or off the couch in the afternoon can be really helpful.
Yeah, yeah. And especially, you know, with nicer weather.
Exactly.
Right? That's a motivating factor.
Exactly. As it slowly starts to cool down, it's very nice to get out and walk.
Wonderful. So what are chronic complications of the disease?
So diabetes can affect several different organ systems. So ones we worry about are blood vessels, and so that can contribute to heart disease, can cause heart attacks and strokes. Diabetes can also affect the kidneys, and if it progresses, people sometimes require dialysis. It can affect nerves in our hands and feet, which lead to loss of feeling. And over time, that can cause complications that can lead to amputations, which I know people very commonly associate with diabetes. We also worry about the effect on the eyes that diabetes can cause as well. It can cause vision impairment and, again, a severe vision loss.
Wow. Okay.
But all of those complications can be prevented with, you know, early recognition of diabetes and appropriate treatment.
Okay. So what are some signs or symptoms that, you know, you may have diabetes?
That's a good question. So very often signs that we see are increased thirst and urination. We also see some people with increased hunger. Unintentional weight loss can be a sign of diabetes. Some people just in general feel poorly, fatigue, and an overall sense of kind of unwellness. Some people have blurry vision as well. Although I will say very often in type 2 diabetes, people don't have any symptoms, or the symptoms are very mild, and so they may not be recognized. And so that's why being seen by physicians regularly, appropriate screening can also be really important in terms of recognizing, especially type 2 diabetes.
Oh, wonderful. Okay. I mean, how often would you recommend getting screened or getting tested, or, you know what I mean?
Yeah, no, that's a good question. And so there are recommendations that are put forward by various medical bodies. In general, people over the age of 45 should be screened for diabetes.
I see.
But we also screen people who are younger who have additional risk factors. So if you're overweight or obese, people with a family history, certain ethnic groups are more likely to have diabetes. Women who have had gestational diabetes are more likely to go on and progress to type 2 diabetes. And so everyone should, I think, have a regular physician who they're having these conversations with and asking if they should be screened.
Regular checkups are probably helpful,
Exactly.
Right?
Preventive care can be very important as well.
Preventive care. Okay, perfect. So how do you manage diabetes?
It's a good question. So some of it depends on the type of diabetes. So type 1 diabetes is by and large managed with insulin, because in type 1 diabetes, our bodies don't produce insulin at all. And so that is managed by insulin injections. Type 2 diabetes has several different ways that it's managed. First and foremost is healthy diet and increased activity.
Sure.
And then we also have several different medications. Some are pills, some are injection medications that we use to manage. They can be very effective in managing type 2 diabetes. And then some people do require insulin as well.
And is insulin, is it just a shot, or what does that look like?
It is. It's an injection.
Okay. So it could be worse.
It could be worse.
Right?
It could be
all things
worse.
considered.
Exactly. Exactly.
Yeah.
You know, and I think again, one of the most important things is sort of early recognition and lifestyle changes at the time that diabetes is diagnosed. For a lot of people, that can either avoid or certainly delay the progression to the point where they would require insulin, and we can use other things like pills to manage diabetes effectively, which is always our goal.
Thank you for your time today.
Thank you so much for having me.
So to learn more about Ochsner's diabetes management program, you can log on to ochsner.org/services/diabetes.